Bipolar disorder is a severe, lifelong mental health problem that was formerly classified as manic depressive sickness. Physicians categorize it as a mood disorder for this reason. In the world, bipolar illness ranks as the sixth most prevalent cause of disability. Bipolar disorder is characterized by extreme fluctuations in a person's mood, energy, and concentration levels, sleep patterns, behavior, and cognitive abilities. Individuals with bipolar disorder go through episodes of severe mania, which makes them feel excessively happy, euphoric, or agitated. And they also go through depressive episodes, which make them feel depressed, worthless, and hopeless. These fluctuations are different from the normal mood fluctuations that everyone goes through. The symptoms of bipolar disorder are more severe. These fluctuations can last for hours, days, weeks, or months and can be severe and disruptive. It significantly influences an individual's everyday life, relationships, social life, and capacity to function. Untreated bipolar disorder can be so severe that individuals might consider suicide. The exact cause of bipolar disorder is unknown. Experts believe there is a complex combination of physical, environmental, and social factors that work together to make an individual more likely to develop the condition. There's some evidence that if there's an imbalance in the levels of one or more neurotransmitters, an individual may develop some symptoms of bipolar disorder. It's also thought that bipolar disorder is linked to genetics, as the condition seems to run in families. The family members of an individual with the condition have an increased risk of developing it themselves. However, no single gene is responsible for bipolar disorder. Rather, a number of genetic and environmental factors are thought to act as triggers. Bipolar disorder typically impacts a person before the age of 20. It rarely develops after the age of 40, but it can occur later in life. All individuals have changes in their mood, which have a big impact on an individual's life, but an individual with bipolar disorder may have manic and hypomanic episodes, depressive episodes, mixed episodes, or stable periods. This can be very difficult and confusing. Not everyone experiences these mood episodes in the same way or for the same amount of time. Although manic and hypomanic episodes are distinct, they share symptoms that are similar. Severe mania is very serious and frequently requires hospital care. Hypomania can noticeably change the mood or behavior of an individual, but it's less severe than mania. Manic episodes can impact an individual's ability to do their daily activities, often disrupting or completely stopping them. Hypomanic episodes can disrupt an individual's life, but they may still feel able to work or socialize. A mood episode needs to last for more than a week before it can be classified as mania. For hypomania, it needs to last for 4 or more days. However, manic and hypomanic episodes can extend well beyond this time frame. Both a manic and a hypomanic episode may include some of these symptoms: abnormally upbeat, jumpy, or wired, confident or adventurous, a decreased need for sleep, easily distracted and can't concentrate, feeling untouchable, an increased sexual energy, irritable or agitated, poor decision-making, unusual talkativeness, being very excited or uncontrollably excited. Depressive episodes are stages of feeling extremely low. They last at least 2 weeks, but can last much longer. They usually last for months. Similar to manic or hypomanic episodes, they can seriously interfere with the individual's day-to-day life. Severe depression may require medication or hospitalization. For some individuals, dealing with depressive episodes can feel much harder than dealing with manic or hypomanic episodes. The difference between your high and low mood episodes may make an individual's depression seem even more extreme. During a depressive episode, the individual might feel agitated and tense, down, upset, or tearful, guilty, worthless, or hopeless. You can't concentrate on anything, lack of self-esteem and confidence, suicidal, tired or sluggish, uninterested in things they usually enjoy. The individual may experience symptoms of both depression and mania, or hypomania depression, at the same time. For example, the individual may feel very irritable or agitated. Or the individual may feel very upset or tearful while feeling very energized and impulsive. the individual may also experience highs and lows very quickly after each other, within the same day or hour. These mixed episodes can be particularly difficult to cope with, as it can be tougher for the individual to figure out what they are feeling. To identify what help is needed can be tougher for the individual. The individual might find managing their emotions harder and exhausting. The individual's loved ones, friends, or medical doctor might struggle to find the best way to support the individual. The individual may be more likely to act on suicidal thoughts and feelings. Not everybody with bipolar disorder experiences psychosis, but some individuals do. It's more likely to occur during manic episodes, but it can also occur during depressive episodes. These types of experiences can feel very real to an individual at the time, which may make it hard for the individual to understand other people's concerns. Psychotic symptoms can include delusions, such as paranoia, hallucinations, such as hearing voices, confused and disturbed thoughts. It is most common to have stable periods in between the episodes. This does not mean that the individual has no emotions during this time. It means that they are not currently experiencing mania, hypomania, or depression episodes, or that they are managing their symptoms effectively. The individual might find themselves feeling stable for months or years in between episodes. Or their periods of stability might be much shorter. Stable periods can feel like a relief to the individual. But they can also feel challenged in their own way. The individual may feel embarrassed or guilty about things they did or said when they were unwell, joyful, happy, peaceful, or relieved. They have lots to sort out or catch up on. They have to get back to normal life right away, nervous about becoming unwell again, not sure about whether they must continue with medication or treatment. Bipolar disorder comes in the three main types: bipolar disorder 1, bipolar disorder 2, and cyclothymia. Bipolar 1 disorder is the more severe form of bipolar. It is diagnosed when an individual experiences at least one manic episode that lasts a week or longer. That episode may be extreme and dangerous, and it is so severe that hospitalization is required. The individual may also experience hypomanic episodes or depression, but they don't have to have a major depressive episode to be diagnosed with this type. Most individuals with bipolar 1 disorder also have periods of neutral mood. Bipolar disorder 2, although this type always encounters depressive episodes with occasional hypomania, it can resemble bipolar 1. Bipolar 2 isn't a milder form of bipolar, it's a separate diagnosis. Individuals return to their usual functioning between episodes. Individuals with bipolar 2 disorder frequently have other mental illnesses, the latter of which can exacerbate symptoms of depression or hypomania. Some individuals with bipolar 2 go on to develop bipolar 1. A less severe type of bipolar disorder is referred to as cyclothymic disorder. It involves repeated mood shifts between hypomania and depressive episodes that occur frequently for at least 2 years and do not stop for more than 2 months. Individuals with cyclothymia experience emotional ups and downs, but with less severe symptoms than those with bipolar 1 or 2 disorder. Treatment is best guided by a psychiatrist who specializes in diagnosing and treating mental health conditions. Bipolar disorder is a chronic condition. Treatment is directed at managing the individual's symptoms. Depending on their needs, treatment may include medication, that is the cornerstone of bipolar disorder's lifelong treatment. Psychotherapy is a term for various treatment techniques that focus on helping an individual identify and change worrying emotions, thoughts, and behaviors. Psychotherapy can offer skills, education, support, and strategies to individuals with bipolar disorder and their loved ones. Treatment for substance abuse is required if the person struggles with drugs or alcohol. Hospitalization may be recommended by the psychiatrist if the individual behaves dangerously, feels suicidal, or becomes detached from reality. Other treatment options depend on the individual's needs. Complications: if bipolar disorder is left untreated, it can lead to catastrophic outcomes that impact every aspect of your life, including damaged relationships, drug and alcohol use, financial or legal problems, poor performance at work or school, suicide, suicide attempts, or suicide thoughts. Certain medical conditions may exacerbate the symptoms of bipolar disorder or reduce the effectiveness of treatment. Examples include alcohol or drug problems, anxiety disorders, attention deficit hyperactivity disorder, eating disorders, physical health problems. There's no sure way to prevent bipolar disorder. Getting treatment at the earliest indications of a mental health disorder, on the other hand, can help prevent bipolar disorder or other mental health conditions from worsening. If you've been diagnosed with bipolar disorder, some strategies can help prevent minor symptoms from progressing to full-blown episodes of mania or depression. Pay attention to warning signs. Addressing symptoms early on can help prevent episodes from becoming more severe. You may have identified a pattern in your bipolar episodes and what triggers them. If you suspect you are going through a depressive or manic episode, contact your medical professional right away. Involve loved ones or friends in keeping an eye out for warning signs. Avoid drugs and alcohol. Using alcohol or illegal substances can aggravate your symptoms and make them more severe. Take your medications exactly as directed. You may be tempted to discontinue treatment, but resist. Stopping or reducing your medication on yourself may result in unpleasant withdrawal effects, or your symptoms could get worse or return.